Do you or a loved one wake up at 3 a.m., staring at the ceiling, wondering why your body betrays you? You're not alone. But here's the truth. Those midnight awakenings aren't just normal aging. They're a silent alarm, a warning sign your body is sending about hidden health risks. Today, we'll expose the 5 shocking reasons seniors wake up at 3 a.m. and the most critical step you must take to reclaim restful sleep. But let me warn you, the last solution we'll share, it's the game changer most people ignore, and it's the one you'll wish you knew years ago. Stick with me. I'll show you how to turn those restless nights into deep, rejuvenating sleep. So why does this happen? As we age, our sleep architecture changes. First, circadian rhythm shifts. Our internal clock becomes less efficient, making us prone to early awakenings. 2. Reduced deep sleep. The restorative sleep we need to heal our bodies becomes scarcer. 3. Environmental triggers. Light, noise, or even a slightly warmer room can jolt us awake. But here's the catch. While these changes are common, they can also mask serious health issues, which brings us to the 5 hidden signals you need to know. 1. Insomnia and circadian rhythm disorders. Insomnia and circadian rhythm disorders are significant sleep issues affecting older adults, with far-reaching consequences on their daily lives and overall health. Insomnia, characterized by difficulty falling asleep, staying asleep, or achieving restorative sleep, is prevalent among seniors, affecting up to 50% of this population. The symptoms of insomnia in older adults can range from fragmented sleep patterns to daytime fatigue and mood disturbances. Particularly common in this age group are sleep maintenance issues, where individuals wake up in the middle of the night and struggle to fall back asleep. The high prevalence of insomnia in seniors can be attributed to various factors. Age-related changes in sleep architecture play a significant role, as older adults tend to experience less deep sleep and more frequent awakenings throughout the night. Additionally, underlying health conditions, which are more common in the elderly, can exacerbate sleep disturbances. Circadian rhythm disorders, particularly advanced sleep phase disorder, ASPD, further complicate sleep patterns in older adults. ASPD causes a shift in the internal body clock, resulting in early evening sleepiness and early morning awakenings. This misalignment between an individual's biological clock and societal norms can lead to shortened sleep duration and excessive daytime sleepiness. The impact of these sleep disorders extends beyond nighttime discomfort. Insomnia in older adults is associated with increased risks of depression, anxiety, and cognitive decline. It can also lead to daytime fatigue, affecting daily activities and quality of life. Treatment options for insomnia and circadian rhythm disorders in seniors include both non-pharmacological and pharmacological approaches. Cognitive behavioral therapy for insomnia, CBTI, has shown favorable and enduring benefits. For circadian rhythm disorders like ASPD, bright light therapy and chronotherapy can help realign the body's internal clock with desired sleep-wake times. It's crucial for healthcare providers to conduct thorough evaluations when older adults report sleep issues, as insomnia can often coexist with other sleep disorders or medical conditions. By addressing these sleep disturbances effectively, we can significantly improve the overall health and well-being of our aging population. 2. Sleep apnea or breathing issues. Sleep apnea is a serious and often underdiagnosed sleep disorder that disrupts restful sleep by causing repeated interruptions in breathing during the night. The most common form, obstructive sleep apnea, OSA, occurs when the muscles in the back of the throat relax excessively, narrowing or completely blocking the airway. These blockages force the brain to briefly wake the individual to restore airflow, often accompanied by loud snoring, gasping, or choking sounds. Although these episodes might not be remembered upon waking, they fragment sleep and prevent the body from entering deep, restorative stages of rest. OSA is particularly prevalent among older adults, with studies showing that up to 56% of individuals aged 65 and older are at high risk for this condition. Symptoms of OSA include excessive daytime fatigue, morning headaches, dry mouth upon waking, irritability, and difficulty concentrating. Over time, untreated OSA can lead to serious health complications such as cardiovascular disease, high blood pressure, type 2 diabetes, and cognitive decline. Another less common form of sleep apnea is central sleep apnea, CSA. Unlike OSA, CSA is caused by a failure in communication between the brain and the muscles responsible for breathing. This results in irregular breathing patterns during sleep, including pauses or shallow breaths. CSA can also cause frequent awakenings and daytime fatigue, but often requires different treatment approaches compared to OSA. Both forms of sleep apnea demand timely diagnosis and intervention. A definitive diagnosis is typically made through a polysomnography test or sleep study, which monitors breathing patterns, oxygen levels, and brain activity during sleep. Home-based sleep tests are also available for initial screening, but may lack the comprehensive data provided by lab-based studies. Treatment options vary depending on severity, but often include continuous positive airway pressure, CPAP therapy, which uses a machine to keep airways open during sleep. For milder cases or individuals who cannot tolerate CPAP devices, lifestyle modifications such as weight loss, positional therapy, avoiding sleeping on the back, and avoiding alcohol or sedatives before bed can significantly reduce symptoms. In some cases, oral appliances designed to reposition the jaw or surgery to remove excess tissue obstructing the airway may be recommended. Sleep apnea not only affects nighttime rest, but also poses significant risk to overall health if left untreated. By seeking medical evaluation and adhering to prescribed treatments, individuals can improve their quality of sleep and reduce their risk of long-term health complications. 3. Nocturia, frequent nighttime urination. Nocturia, defined as waking up more than once during the night to urinate, is one of the most common causes of sleep disruption in older adults. While it is often dismissed as a normal part of aging, nocturia can significantly impact quality of life, leading to fragmented sleep, daytime fatigue, and even serious health risks, such as falls during nighttime awakenings. Studies show that nearly two-thirds of adults aged 55 to 84 experience nocturia at least a few nights per week. The causes of nocturia are multifactorial and often linked to age-related changes in the urinary system. As people age, bladder capacity tends to decrease, and the ability of the kidneys to concentrate urine diminishes. This can lead to an increased need to urinate during the night. Additionally, medical conditions such as diabetes, congestive heart failure, hypertension, and benign prostatic hyperplasia, BPH, in men often contribute to excessive nighttime urination. For many seniors, lying down at night redistributes fluid from swollen legs, a condition known as edema, back into circulation, increasing urine production while they sleep. Another common cause is nocturnal polyuria, a condition where an abnormally large volume of urine is produced during sleep. This can result from hormonal imbalances, such as reduced secretion of antidiuretic hormone, EODH, which normally helps the body retain water at night. Other contributing factors include urinary tract infections, UTIs, overactive bladder syndrome, and side effects from medications like diuretics. The consequences of nocturia extend beyond sleep loss. Frequent awakenings can lead to cognitive impairment, depression, and social isolation due to chronic fatigue. More alarmingly, nocturia-related falls are a significant concern for older adults, often resulting in injuries like hip fractures that can severely affect mobility and independence. Managing nocturia. Managing nocturia involves addressing both lifestyle factors and underlying medical conditions. Here are some evidence-based strategies. 1. Lifestyle adjustments. Limit fluid intake in the 2 hours before bedtime. Avoid beverages that irritate the bladder, such as those containing caffeine or alcohol. Elevate the legs during the day or wear compression stockings to reduce fluid buildup in the lower extremities. Maintain a consistent sleep schedule and create a calming bedtime routine. Second, medical interventions. Treat underlying conditions such as diabetes or BPH with appropriate medications or therapies. For individuals with overactive bladder or nocturnal polyuria, medications like anticholinergics or desmopressin may be prescribed under medical supervision. Address any infections or prostate-related issues through targeted treatments like antibiotics or surgery if necessary. 3. Behavioral therapies. Bladder training exercises can help increase bladder capacity and reduce urgency. Pelvic floor exercises, Kegels, may benefit those with weakened pelvic muscles, contributing to frequent urination. Nocturia is not merely an inconvenience, but a condition that warrants attention due to its potential impact on health and safety. By identifying its root causes and implementing tailored interventions, older adults can improve their sleep quality and overall well-being while reducing associated risks like falls and fatigue. 4. Restless leg syndrome, RLS. Restless leg syndrome, ARLS, also known as Willis-Ekbom disease, is a neurological disorder that creates an overwhelming and often distressing urge to move the legs. This urge is typically triggered by uncomfortable sensations such as tingling, crawling, itching, or pulling, which are most commonly felt in the calves but can also affect the thighs, feet, and even arms. These sensations usually occur during periods of rest or inactivity, such as lying down or sitting for extended periods, and are temporarily relieved by movement like stretching, pacing, or rubbing the legs. RLS symptoms are particularly disruptive at night, often worsening in the evening or shortly after midnight. This makes it difficult for individuals to fall asleep or stay asleep, leading to fragmented sleep patterns and excessive daytime fatigue. In severe cases, RLS may also be accompanied by periodic limb movement disorder, PLMD, involuntary jerking or twitching of the legs during sleep, which affects up to 90% of people with RLS. These repetitive movements further compound sleep disturbances and contribute to poor quality of life. Although RLS can occur at any age, it becomes more common and severe with age, particularly in older adults. The exact cause of RLS remains unclear in many cases, but it is often linked to underlying conditions like iron deficiency anemia, kidney disease, diabetes, nerve damage, or even certain medications. Dopamine dysfunction in the brain is believed to play a significant role in the development of RLS symptoms. In some cases, RLS runs in families, primary RLS, while in others, secondary RLS. It may result from specific health conditions or lifestyle factors. Managing restless leg syndrome. Effective management of RLS focuses on alleviating symptoms and addressing any underlying causes. 1. Lifestyle adjustments. Regular physical activity during the day can help reduce symptoms, but should be moderate. Overexertion may worsen discomfort. Avoiding caffeine, alcohol, and nicotine, especially in the evening, can minimize triggers. Establishing a consistent bedtime routine and maintaining good sleep hygiene can improve overall sleep quality. 2. Nutritional support. Iron deficiency is a common contributor to RLS. Iron supplementation may be recommended if blood tests reveal low ferritin levels. Ensuring adequate intake of magnesium and folate may also help alleviate symptoms. 3. Medical treatments. For severe cases that significantly disrupt sleep or daily life, medications may be prescribed. These include dopamine agonists, e.g., pramipexole or ropinirole, to regulate dopamine levels in the brain, or anticonvulsants like gabapentin to manage nerve-related discomfort. In some cases, opioids or benzodiazepines may be used cautiously for symptom relief when other treatments are ineffective. 4. Self-care techniques. Applying heat or cold packs to the legs can provide temporary relief from discomfort. Gentle stretching exercises before bed can relax leg muscles and reduce nighttime symptoms. While RLS is not life-threatening, its impact on sleep and daily functioning can lead to secondary issues like anxiety and depression if left untreated. By identifying triggers and implementing tailored treatments, whether through lifestyle changes, nutritional support, or medical intervention, individuals with RLS can significantly improve their quality of life and restore restful sleep. 5. Mental health factors. Stress, anxiety, depression. Mental health plays a crucial role in sleep quality, particularly for older adults. Stressful life events, chronic anxiety, and depression can significantly disrupt sleep patterns, leading to early awakenings or difficulty falling back asleep after nighttime disturbances. For seniors, these mental health factors can be exacerbated by life changes such as retirement, loss of loved ones, or health concerns. One of the most common sleep-disrupting phenomena experienced by older adults with mental health issues is rumination. This occurs when the mind becomes caught in a cycle of repetitive, often negative thoughts during nighttime awakenings. These racing thoughts can make it extremely difficult to return to sleep, leading to fragmented sleep patterns and daytime fatigue. The relationship between mental health and sleep is bidirectional. Poor sleep can worsen mental health conditions, while mental health problems often lead to sleep disturbances. This creates a vicious cycle that can be challenging to break without intervention. Depression, in particular, is strongly associated with sleep problems in the elderly. The tendency toward increased arousals and early morning awakening in older adults can be severely exacerbated by depression. Additionally, the psychological manifestations of various life changes that elderly persons often experience, such as physical limitations or changes in living situations, can contribute to sleep deterioration. Cognitive behavioral therapy for insomnia, CBTI, has emerged as an effective non-pharmacological treatment for addressing these psychological factors affecting sleep. CBTI helps seniors identify and change thoughts and behaviors that interfere with sleep. This approach is particularly beneficial as it avoids the potential side effects and dependencies associated with sleep medications. Relaxation techniques such as mindfulness meditation or progressive muscle relaxation can also be valuable tools in calming the mind before bed. These practices can help reduce anxiety and stress, making it easier to fall asleep and stay asleep throughout the night. For more severe cases of anxiety or depression that significantly impact sleep, consulting a mental health professional for therapy or medication may be necessary. It's important to note that some older adults may mistakenly attribute poor sleep to aging alone, when in fact it could be a sign of an underlying mental health condition that requires attention. By understanding and addressing these mental health factors, along with other hidden health signals like insomnia, circadian rhythm disorders, sleep apnea, nocturia, and restless leg syndrome, seniors can take targeted steps toward improving their sleep quality and overall well-being. Recognizing the complex interplay between mental health and sleep is crucial for developing comprehensive strategies to enhance both aspects of health in older adults. How to restore peaceful sleep. 1. Maintain a consistent sleep routine. One of the most effective ways to improve sleep quality is by maintaining a consistent sleep schedule. Going to bed and waking up at the same time every day, even on weekends, helps regulate your body's internal clock, also known as the circadian rhythm. This consistency trains your brain and body to know when it's time to wind down and when it's time to wake up, reducing nighttime awakenings and improving overall sleep quality. Avoiding naps late in the day is also crucial, as they can disrupt your natural sleep drive. 2. Optimize sleep environment. Creating an ideal sleep environment is essential for restful sleep. Keep your bedroom cool, quiet, and dark. Studies suggest that a room temperature of around 65 degrees Fahrenheit, 18 degrees Celsius, is optimal for most people. Use blackout curtains or an eye mask to block out light, as even small amounts of light can interfere with melatonin production, the hormone responsible for regulating sleep. Reduce noise with earplugs or a white noise machine if necessary. Additionally, ensure your mattress and pillows are comfortable and supportive, as discomfort can lead to frequent awakenings. 3. Stay active during the day. Regular physical activity during the day has been shown to improve sleep quality, especially in older adults. Exercise helps regulate your circadian rhythm by increasing your body's need for restorative sleep at night. Aerobic activities like walking, swimming, or cycling are particularly effective in promoting deeper sleep stages. Additionally, spending time outdoors in natural sunlight during the morning or early afternoon can help reset your internal clock and improve melatonin regulation. However, avoid vigorous exercise within 3 hours of bedtime, as it may leave you feeling too energized to fall asleep. 4. Avoid stimulants and alcohol. Before bed stimulants like caffeine and nicotine can interfere with your ability to fall asleep and stay asleep by increasing alertness and disrupting your natural sleep cycle. Limit caffeine intake to the morning hours and avoid nicotine altogether if possible. While alcohol may initially make you feel drowsy, it disrupts REM, rapid eye movement, sleep, the restorative stage of sleep, and often leads to nighttime awakenings. For better sleep hygiene, avoid consuming alcohol or stimulants in the late afternoon or evening. 5. Try cognitive behavioral therapy for insomnia, CBTI. Cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard for treating chronic insomnia without medication. This evidence-based therapy helps individuals identify and change negative thoughts or behaviors that interfere with sleep. CBTI focuses on techniques such as stimulus control, using the bed only for sleep, relaxation exercises like deep breathing or progressive muscle relaxation, and sleep restriction therapy, limiting time spent in bed awake. By addressing both mental and behavioral barriers to sleep, CBTI has shown long-term effectiveness in improving sleep quality. If these strategies don't improve your sleep, or if you experience persistent 3 a.m. awakenings despite lifestyle changes, it's important to consult a healthcare provider. Professional evaluation is especially critical if you suspect conditions like obstructive sleep apnea, characterized by snoring and gasping, restless leg syndrome, RLS, or nocturia caused by underlying health issues like diabetes or prostate problems. A doctor can recommend diagnostic tests such as a polysomnography, sleep study, or blood tests to identify deficiencies or imbalances contributing to poor sleep. Waking up at 3 a.m. may feel frustrating, but it doesn't have to be permanent. By understanding the hidden health signals behind these disruptions, like insomnia, circadian rhythm disorders, or mental health factors, and implementing targeted solutions such as maintaining a consistent routine, optimizing your environment, staying active, and exploring CBTI, you can take control of your nights again. If you found these tips helpful, try incorporating them into your daily routine and let us know how they work for you. Share your experiences or questions in the comments below. We'd love to hear from you. Don't forget to subscribe for more health and wellness tips designed just for you.